We'll move on to the Reports tab now. From the Reports tab, you can view results of multiple procedures, including imaging, immunizations, and procedures, among other things. We won't go through all the reports functions now, but if you have any questions about any of these functions, please follow up with your preceptor or instructor. We'll go over some basic concepts you may find useful when looking up your patient's information. On the left side, you'll see a window with all available reports housed in CPRS. Please note the reports with the words local only in parentheses will show you only results from the Portland VA and surrounding facilities. Let's start with clinical reports. The results under this heading can also be found in other tabs throughout CPRS, but you can use this as a one-stop shopping area for results reporting. Click on the arrow to expand the clinical reports area. Now we'll click on the arrow under patient information, and we'll find demographic information such as address, next of kin, insurance information, and disabilities. The Visits and Admissions section displays a list of all past and future visits, inpatient admissions and procedures. Click on each category to get a history of your patient's visits. We can change the date range and the upper portion of your screen if we're not seeing very many visits. Selecting the past clinic visits is a good way to see what specialty services your patient has utilized. Clinical reports also includes an allergy list. Let's go down to the Pharmacy tab now. Once you've expanded the Pharmacy tab, you can select All Outpatient to see a list of all outpatient medications, which appears on the right side of your screen. You can sort these medications by clicking on any of these headings, like drug name, status, or issue date. Under Clinical Reports, we can also click on this Anticoagulation Flowsheet. This is really useful if your patient has ever received or is receiving anticoagulants for a specific condition. You can click on this section, and on the right side, we'll see a history of your patient's INR readings and Coumadin dosing instructions based on the INR. We can also see any additional comments from the providers regarding anticoagulation concerns. Now let's go down to the Health Summary section. This section includes some important information about your patient's condition. I'd like to draw your attention to immunizations. This section shows immunizations your patient has received, including when and where it was given. This information is especially important during flu season when patients often forget when or if they've received a flu vaccine. There are a lot of other really great places to get information about your patient in the Health Summary section. I would encourage you to take some time and look this over. Now I'm going to switch to a new patient so I can show you some other functions. Let's go to Imaging Local Only. This section shows the results of all X-rays, CT scans, Doppler imaging studies, or other imaging scans that have been completed on your patient. The reports of these scans show up in the headings at the top of your screen. Click on the report to see the radiologist's read and impression down at the bottom of your screen. A little blue icon next to the report means that there are photos or other documents associated with this report, which you can view in Vista Imaging. Next, we'll go to Procedures, local only. This section includes all procedures performed on your patient at the Portland VA. These procedures are usually EEGs, echoes, stress tests, cardiac catheterizations, hemodialysis, or sleep studies, for example. Click on each report and we can bring up the details at the bottom of your screen. Let's go down to the Flowsheet section now. The Care Plan report lists the active nursing problems for your patient. These problems are added or changed by nurses throughout the patient's admission. Unfortunately, this function doesn't work on the test patients, but on an actual patient, you would see a list of active nursing problems on the right side of your screen. If your patient is on a continuous drip, like insulin or heparin, you can click on insulin drip or heparin flow sheet to see more information. And this includes the time that drips were initiated or changed throughout the day, and I'll also include related labs. This is another place where you can view the anticoagulation flow sheet as well.